Physical factors that influence wound healing and repair. These are mechanical or environmental conditions that influence wound closure and repair. Number one, mechanical stress and movement. Excessive movement or tension at wound edges puts the wound at risk of wound dehiscence or reopening. Poor immobilization, for example in fractures, surgical sites, delays repair. Number two, temperature. Cold exposure causes vasoconstriction, which is the narrowing of blood vessels due to contraction of smooth muscles, especially in the arterioles, which leads to reduced blood flow and oxygen delivery. Moderate warmth promotes vasodilation, which is the widening of blood vessels due to relaxation of the smooth muscle in the vessel wall, mainly in the arterioles, and enzymatic activity for repair. Number three, pressure. Constant pressure, e.g. in bedridden patients, causes ischemia, leading to pressure ulcers or bed sores. Number four, radiations. For example, radiation therapy damages DNA, impairs fibroblast proliferation, and reduces vascularity, leading to chronic non-healing wounds. Number five, foreign bodies, for example, sutures, debris, or splinters left in the wounds, maintains chronic inflammation and delay healing. Number six, size, location, and depth of the wound. For example, large or deep wounds require more tissue granulation, hence slower healing. Poor vascularized sites, e.g. tendons, ligaments, and cartilage, heal slowly. Areas with high tension or mobility, like joints and back, are more prone to delayed healing.